So today's class we are going to discuss regarding squint, and squint is otherwise known as strabismus. So it's a common pediatric disease condition. Okay, so now let's see regarding what is squint and what is the etiology, what are the clinical manifestation, how we can diagnose this condition, and what are the immediate management we can do to preserve the vision of the child. So squint or strabismus is a condition in which the child's eyes do not align properly. So many clinical varieties are seen. So where the eye will be turning inward or upward, downward or outward, and the remaining the second eye will be focusing upon the one spot. So here one eye will be having the defect or both the eyes will be having the defect. So let's see regarding the etiology. And etiology, it is congenital. That is by birth itself, some children are developing this strabismus, and it is hereditary also. If the family members like parents, they are having the history of strabismus, more chances for the child to develop this condition. And this can result from any kind of illness like long sightedness, or any myopia, etc. So, myopia, hypermetropia are also considered as the reason for the development of strabismus, and it is also can develop due to a lesion that is happening in the cranial nerve. So, if any lesions or any injuries or any tumor growth happening in the nerve which is helping in the vision, so that is also considered as a cause. Then astigmatism, where the cornea is not curved properly. Then any infections of the childhood that is affecting the brain is also considered as a reason for the development of strabismus. Now we'll see the pathophysiology. So usually this is developing because the muscles that control the eye movement, especially the eye, eyelid, etc. So you usually call them as the extraocular muscles. So these are the muscles. This helps in the proper movement of the eye as well as the eyelid. So if these muscles are not working properly and if they are not working together, there are chances for development of strabismus. So because of this, both the eyes are unable to look at the same point at the same time, and so most of the time this can also happen because of the any disorders that is affecting the cranial nerves or the brain. Because of that also, the eyes cannot correctly coordinate their activities. So this strabismus, which will make the binocular vision impossible, and it will be harder for the child to identify the depth of their perception. So this is actually what is happening in the pathophysiology, where the extraocular muscles won't be working together. Hence, the eyes cannot coordinate the vision on the particular point. Okay. So coming to the clinical types, so there are various clinical types. So, and these clinical types are described by the cause and the way how the eyes are turned. So first one is hypertropia. So where the eyes are turning upward. So either one eye or both eye. The next one is hypertropia, where the eyes will be turned downward. Okay. And esotropia, when the eyes are turning inward. And exotropia means where the eyes will be turning outward. So I can show you a picture. In that it will be clear for you. So this is the comparison. So you can see the normal. So here both the eyes are sporting at the same point. And in esotropia, the eye is turning inward. So here the one eye will be focusing upon the spot and the other eye will be turning inward. Then in exotropia, this is the opposite. So here the eyes will be turning outside. And in hypertropia, one eye is turned upward, and in hypertropia, the particular eye is turned downward. So this is the major four classification of the strabismus. Now we'll see regarding the clinical manifestations. So usually the signs of the skin will be fairly clear from the early age itself. So where if you assess the child, any one of the eye that would not be looking at straight ahead. And sometimes some children like newborn babies as well as the infants, they may be having the crow's eyes, but always crow's eyes is not a sign of the strabismus. Then sometime when you observe the child and the child is looking like he is trying to look at a particular object with his one eye closed, or turning their head to that particular object when they are looking into the object, and all these indicate that they are having some problem with their vision, and that may be possibly because of the squint. So usually Sometimes these congenital strabismus will be present at the time of birth itself, or if it is not there, it can develop within 6 months following the delivery. Okay, so now, how we can diagnose this condition? So diagnosis is on the basis of history collection as well as the physical examination. So in the history, you can collect history from the parents regarding the problems said by the child, like while he looking at some object, he is going near and objecting, or while he is turning his head to one side, or trying to close his one eye, and all these are the history you can collect. And in the physical examination, all the clinical varieties of this strabismus can be visible itself at the time of physical examination. Then regular eye examination can also be done, and in small babies and all, this can be started from the ninth month, because sometimes the before that, if you do the eye examination, the child won't be give you the correct response. Okay, and coming to management, how we can management. So glasses can be preferred, and if any refractive errors like myopia, hypermetropia, other conditions that is causing the squint, the proper eyeglasses can be prescribed based upon the eye examination. Then next one is eye patch. Eye patch means nothing. It can be a covering that can be given over the good eye. So if we cover the good eye, the child will try to look with a certain strain. He will take and look upon the object, and slowly this will help to improve the vision. Then eye drops and eye exercise can be taught to the child, and they also will help. Then next one is botulinum toxin injection. So this is a newly discovered method. So this is also known as Botox injection. So this is an injection which can be injected into the surface of the eye or to the particular extraocular muscles. So as I already said you in the pathophysiology, the squint is developing because of any malfunctioning of the extraocular muscles. So these botulinum toxin injections can be injected over these muscles, and these injection they have the capacity to temporarily weaken the muscles. As a result, for a particular short period of time, the muscles will be relaxed, and the child can easily have a look upon the particular object. Okay, and this will help to align the eyes properly. And this is only given for a short period of time, not for a long period of time. Like if one injection is given, if it can last up to 1 week and all, that's all. So coming to surgical management, so usually surgery is the most common method we follow, and surgery is usually preferred if the other treatments are not very effective. So here the surgery can realign both the eyes and restore the binocular vision. So here the surgeon will move the muscles that connect the eyes to a new position. That is, he may correct the extraocular muscles position, and he will realign the muscles so that the eyes will be turned into the new position. And sometimes the surgeon need to do the surgery upon the both the eyes to maintain the right balance of the vision. So following the surgery also, they need sometimes the childrens they need to continue with the glasses to maintain the clarity of vision. So here I already said you in the surgery the muscles are detached from their original incision site, and they are shifted to a different spot. And during the hospital stay, the child may need to stay in the hospital for maximum 2 days. Within 1 day the child can be discharged to home. And after surgery also, patching therapy is very important, means covering the eye. Then regarding the management, if the squint is treated as early as possible, which means preferably before 2 years of age, the vision loss can be prevented in the child. Okay, so skin is always not a good sign, so it will always having a negative effect upon the child's vision as well as the appearance. So as the child grow older, it will be very difficult for us to treat and manage the skin, and which may result in the loss of vision. Okay, and sometimes cosmetically improving the overall look of the child can be done at any age, but that doesn't provide any effect upon the vision of the child. Okay, so thank you. I hope you got an idea regarding squint. Okay.